Hey, folks, if you haven't done so already, please click that subscribe button below. That'll help us grow as a show, attract better guests. Together, let's make healthcare better for everyone. Once again, click that subscribe button. We'll see you on the next one.
Get ready to take control of your healthcare. Here's your host, Ray Cober.
Yeah, I think the clients are tired of seeing, like you said, double-digit increases each year. And at a time where no one knew any better. We didn't know better. The clients didn't know better. And really the insurance carriers had everybody kind of the wool pulled over their eyes that this is just the way it is. And then, a group of us have all gotten together and now we're realizing there's a better way to do things. And now we're just trying to take that to the masses.
Yeah, for sure. So tell us a little bit, no one raises their hand as a kid and says, "I want to be an insurance man when I grow up." Right? I don't think you were any different, and you didn't start out in Texas, but that's where you are now. Tell us a little bit about your humble beginnings.
Well, yeah, so I started back in Massachusetts. I went to school in University of Tulsa, which brought me to Oklahoma, and then that transferred me into Texas, and I've never been there ever since. So 25 years. The carrier doesn't provide any health care to them. They think that Blue Cross is providing their health care. And I say, no, the doctors are providing the care. They're just determining how much they're paying for it. And so when you start realizing, well, these aren't my doctors. I'm not losing doctors. I'm not changing doctors. We're just changing how the payments are happening. And we're getting more cost controls, transparency. And then with that transparency, we can help the employees more with their care. And then we talk about a lot of the advocacy things we do to, again, further reduce costs, but give better care. So we really started explaining in that conversation where it's not just about money, but it's about taking care of your employees. They really open up and get receptive. And the good thing, one thing I always use, and it works really well for me, I said, you know what, you're with Blue Cross, you're with United Healthcare. The good thing is you're already in your worst case scenario. I can only bring you up from there. I said, so if it doesn't work out, you stay where you are and you know what you're getting. And that really opens them up going, oh yeah, I guess I can only do better.
100%. And that's so true because they truly are in their worst case scenario at that point, whether they believe it or not. I think they're resistant. And the word that I use is a 4-letter word that starts with F. And that word is fear, right? So they're afraid of the unknown. And all that they know is their health insurance ID card with that logo, whether it's Cigna or United or Aetna or any one of the bigs, that gives them a certain level of comfort and peace of mind. They really don't understand, though, that what that means essentially, more often than not, is that they're paying the absolute most that they can for healthcare.
Yeah, and I think we have that conversation about the card, and I'll pull a card out and say, look at your card right now. Your TPA is the carrier, your network is the carrier, your PBM is owned by the carrier. So now we're going to take that apart. We're going to have the same 3 positions or same 3 logos on the card, but they're going to be different ones. And they're going to be there for your vested interest and to make your plan better. And when you start showing that to them, and then even show them the transparency, we'll pull up some of the claims details we have on an ongoing monthly, real-time basis, showing, hey, look at last month. You just had 13 new people come on with GLP-1s. Why? We need to figure out what's going on with that. How can we reduce that? That's $13,000 it's costing you a month. And, your carrier is not going to do anything about it because they're making money off that. I said, that's what this is. We're creating this Google Maps or this Waze for the future to see where you're going. Are there going to be road bumps? What do we need to anticipate? And how do we manage that trip?
Absolutely.
For the next 12 months.
Yeah. And so when you're in a fully insured plan, it really is kind of the worst case scenario for risk strategy because you're managing from behind. And so it's just a terrible way to manage any expense, let alone one of your largest expenses. And so going back to your example, in a self-funded plan, a custom plan where you have real-time access to data, and now a dozen people show up on your plan taking Ozempic, a GLP-1, what is the difference between I'm in a fully insured plan with Blue Cross Blue Shield, and that happens, versus one of your alternative plan designs? What's the advantage to an employer in that scenario?
I think there's a few things. Let's just assume everybody on those drugs or any of these, especially your brand name drugs, they need it. It's just part of they have to have it. Well, the first thing we're doing is because we're using transparent fiduciary PBMs, we typically can lower the cost on those 20, 30, 40%. So you get immediate cost savings by putting taking out the incentives that the PBMs have built in for the carriers right now. So we remove that, we reduce your costs. But
because instead of paying, did you say what the cost of the surgery was elsewhere?
68,000 at the hospital and 24 at the surgery center.
Yeah. So look at that delta. You save the employee all of their traditional out-of-pocket medical expenses. You cover their transportation round trip, and you're still way, way, way ahead of the game. The employee's happy. The organization benefits. Everyone wins.
Yeah, and we've seen those facilities even when we were in the Caymans for one of the masterminds. We toured the facilities. These are top tier, high quality facilities. And you look at the cost savings of some of these surgeries, and you're like, how would you and your family like to go to the Caymans for 4 or 5 days? We'll pay for the trip, no deductible, because it's cheaper than getting it done at a hospital in Florida. And there's just great incentives out there. And it's interesting because a lot of the programs, whether it be physical therapy, labs, we have lab programs and imaging programs where if the employee goes to our advocacy and uses those, they have no cost, no out of pocket, and it reduces the cost of the health plan. So everybody wins.
But what we've given them with the system that we have is that they have insurance, but they're functionally uninsured, right? If you have an employee that is just kind of scraping by, and they're a sole income provider, and they have multiple mouths to feed, and you give them a plan that first dollar coverage starts after they pay a $3,000 deductible, that's useless to them. It is the same as having no insurance at all. So yes, to your point, if now they have a plan where all they need to do is kind of follow the plan that's set, we don't need to make them experts. Just follow the yellow brick road. It's already there, right? Go to where you get your care. We're going to map this out for you, make it easy. And if you just, play along, you're going to end up with a $0 out-of-pocket experience. Most people will say, you're full of shit, Ray. You're full of shit, Dad. Yeah. That's too good to be true. You can't do that. What are you talking about?
Well, that's the words we get a lot of time. This is too good to be true. Even when we do our underwriting, we come back and we'll show. This year, I showed groups that in the fourth quarter, we had renewals, or we did new groups, level funded, self-funded on our platforms. And they were coming in 60, 70. I had one that was 150% under the BUCA rate that they were dealing with. And they got it for free. And our plan only paid 125.
Wow. Yeah.
So we saved $300 to the plan, well, really for the employee, but the employer's like, yeah, we'll pay the 125. They're getting the care they need, and the employee was out nothing. Well, just having that help.
Not to mention that in a traditional hospital setting, that same exam might be 10 times as costly.
Yeah.
10 times. We're not talking about a couple of bucks here, folks. Like, it could be the difference between an $8,000 CAT scan with contrast or an $800 CAT scan with contrast. And as an employer, if you're a CFO listening, just do the math. Think of the numbers. You can pay 80% of 800, or 100% of 800, or 80% of 8,000. What do you want? And at the end of the day, also have your employee or family member of your employee walk away with paying nothing, zero. And
they really only have 1 or 2 doctors in town, and then they have Baylor Scott and White. And we worked with that doctor to do a DPC with that client, and it further reduced their costs. And it made access 7 days a week for the employees, where they could just pop in that office and get anything taken care of. So it was a win for the employees and a win in a cost perspective. But I have another physician client here in Dallas, downtown Dallas. They have about 9 locations. They just purchased a surgery center as well. And we're working with them to create a DPC model into a kind of a level funded health plan here within the downtown area, because we know they've got 8 offices downtown. You have skyscrapers with tons of companies in there. We can direct all that care to them at a much lower cost. And so we're really going to try to build something out, because I think it is there. I've seen it fail, but I think there's an opportunity there for probably, at least half the population. There are going to be people that I'm not changing my doctor and I'm not going to go here. But you'll go pretty much anywhere if you happen to be at work and feel sick that day. You'll walk downstairs 8 floors and go get it taken care of right away. So I think there is a model, but it takes time. We do know, larger companies are starting to put DPCs inside their buildings. I know, like the Toyota here in Frisco, I toured their building when they first opened it, and they've got a DPC model in there, a DPC practice in there. Their employees can go there at any point and get taken care of. So the larger corporations are doing it. Now we're trying to bring it down to the smaller ones.
All right, that's a wrap. Hit like, follow, and subscribe, and we'll catch you next time.